So the one thing you need to do is you need to enable me to share my screen.
Right now.
Perfect.
There you go.
Awesome.
Let me. This is Michelle here. I forgot Michelle just jumped in. Michelle is a senior. I believe Michelle is a business student, right, Michelle? I'm gonna assume that's a yes.
Hi, can you hear me?
Yes,
Yeah.
yes.
Now we can.
Yeah, she's a senior and business student. And also I'm interested in some of the problems that we're facing right now in the healthcare. So
Perfect. Let me know. Can you see the screen?
yes.
Cool. Hey, so thanks again, Francis, for inviting me. Delighted to be here. As you mentioned briefly, I'm a vice president at Google. Part of my focus and my team's focus is really using Google. It was expanded way beyond search and ads, as most of you hopefully should know. But there's a big piece of the business called Google Cloud, right? Where we compete with Amazon Web Services and we compete with Microsoft Azure, which basically is infrastructure to run applications on. And I'm going to make some statements here. If please make this super interactive. Stop me if I'm using lingo or terms that you don't understand. Just say, hey, time out. Tell me what that's about. So what we do with Google Cloud is really use that as infrastructure for other people have specific expertise to build applications on top of, right? So it could be anywhere from, frankly, TikTok runs on Google Cloud, as does Snap, as do a whole bunch of very complex business applications. You or I may not know that just by using it, but a part of what my team does is helps figure out where can we help companies who are moving from traditional applications that run on big servers and so on inside data centers, how to move them into the cloud, right? And a lot of them actually are also in the world of education. But specifically today, what Francis asked me to talk about was how are we doing with things like AI and data, and specifically in healthcare, right? And also a bit of, what has been the impact of the pandemic in, frankly, accelerating what was already happening. But like in many other industries, the pandemic has accelerated we call the digital transformation, right? It's no longer an option, and a lot of companies, a lot of healthcare organizations, a lot of vendors have had to really adapt way faster than they had anticipated, right? So that's really the topic of the discussion today. And while the slides are from Google, I'm going to use it more as a backdrop, but really let's give this as a chat about what's happening in the industry as a whole and where things could be headed. So first off, just a bit of this may be repetitive, some of the things you may have already discussed in prior sessions like this, but a bit of perspective or point of view on the future of healthcare and how is the patient journey changing, right? And here for this discussion, we'll take a US-centric view. It certainly is different in other countries, like we talk about Canada or the UK and others, where there's more of a universal or centralized healthcare system. But nonetheless, some of the elements of the journey still are changing concurrently across the globe. So first off, a lot of focus on digitalization, right? And that really is medical data, and IoMT is Internet of Medical Things. If you've heard of Internet of Things, this is Internet of Medical Things, right? So devices that you walk into a clinic or a doctor's office or hospital, those devices are increasingly being connected to the internet, right? It could be an MRI machine, could be a CAT scanner, could be an X-ray machine. All those things now increasingly are not standing alone. They're actually connected to the plugged into the network, because that's how they share data. That's how they store the data. That's how they analyze it and so on, right? So there's a lot of work, and it really starts to create things like home medicine, right? You can plug in monitors inside the house that can track metrics and so on and report back, etc. So whether it's in the clinic, in the hospital, in the house, there's a lot of focus on the whole digital aspects of how data is being captured, transmitted, and so on. Secondly, a lot more virtual care, right? And this was, again, the pandemic clearly accelerated this, which was, on the one hand, there was a shortage of physicians and nurses, which many of you should probably know about, and kudos to those of you who are going into that realm. And it is also something that, just by nature of kind of the economic model behind healthcare here, creating telemedicine, creating ability to do virtual visits and so on, really starts to help, make it more accessible, to the point of accessibility, right? How can we drive more access? If someone needs specialist care, they may be in a remote location, they may be in, a rural area, whether in the US, maybe in somewhere in Africa, somewhere in Asia, but they need access. They need to be able to connect with physicians, with specialists. Well, this starts to make that much more facile, right? So there's lower cost, and it does require different ways for both the physicians, the nursing staff, et cetera, to engage, to communicate, to kind of process that relationship, right? But that's a big trend, and we're seeing certainly a lot of focus. How do we make virtual care become a much better experience than it might be just by, through a Zoom call or something? Third, which we'll talk a lot more about, is really the use of AI and AI powered decision making, right? So whether it's around care, whether it's around operations and the kind of the hospital or the healthcare system itself, whether things like um, robotic surgeries, which is again becoming an element of both efficiency and cost, and frankly, in many cases, quality. It's a big part of how data is being used, and AI and machine learning are being used to really optimize the delivery of healthcare. And fourth, one of the biggest challenges in healthcare, and this has been ongoing for a long time. I'm also founder of a company, kind of a small company in the healthcare space as well, healthcare technology. The data in healthcare is very disparate. It sits in various different systems. There's a lack of standardization. I'll have a slide later on that shows all the different standards that exist, by country, by topic area. And that makes it really, really hard, right, for systems to communicate with each other. How do I share, my medical record data from a primary care physician to a specialist, if in the in the old days, it would be a chart, a handwritten chart that gets faxed over, right? Some of you might not even know what a fax is. Well, now it's digital, but it may not get easily interpreted by the recipient, by the physician or the lab you're sending it to. So making that work in behind the scenes, that's a massive, massive amount of work, and it's really hard, right? So these are some of the things that we're seeing from a technology perspective that both create opportunity, but also, frankly, make it challenging. And Francis, I don't know the structure, but please, like I said earlier, please ask questions. Like if it's raising hands, if it's whatever, I got the screen going here too. So please feel free to interrupt.
Okay, will do. Thank you.
So in addition to that, I think the journey of the patient, and I'll talk about this in a few different ways. There's a lot going on as well, right? So if we just think about, at the end of the day, the focus of healthcare is improving outcomes, right? And it's not about cost management. It's not about, the latest and greatest drug discovery. It is absolutely about helping patients either prevent disease or address disease, right? And drive better outcomes. So with that in mind, there's just a lot of data that can be unlocked. And if you go through this cycle here, I won't go through every one of these, but from a personal health data perspective, right? There's a lot of data within an individual's realm, right? People are doing a lot more of these genomic tests, for example, that kind of define their ancestry, their potential genomic map, and potential risk areas for them, right? So there is a chance to use that data, use those insights to predict and intercept diseases, right? So there's a lot more of that becoming more prevalent in the marketplace. Second, personal health devices, right? I wear a Fitbit, and whether it's an Apple Watch, a Fitbit, all these other devices, where we're using it to monitor, different metrics, right? Both exercise, Could be blood sugar, could be, my heart rate, sleep times, etc. Right? Now that's another set of data, right? And you can start looking at patterns, looking at trends, looking at how things are evolving. But that data sitting in a different silo, back to the point about, different systems. This data syncs with my Fitbit app. That basically is mine, right? By the way, Fitbit is on my Google as well now. But that data, unless I choose to share with someone, it is sitting inside my account, right? And not being shared with anybody else. Then you have, obviously labs. We have a lot of surgical data from, you know, systems that can go in and drive much more efficient engagement within a hospital setting, in a operating room, and so on. We have a lot of administrative, right? So one of the big reasons, and I'm presuming you folks have talked about this, one of the big reasons healthcare in the US is so expensive, and it's still growing at the cost is growing at such a fast clip. There is a huge amount of administrative overhead. And there is some analysis that says that it's even north of 40% is administrative cost, right? Administrative cost is just, let's call it what it is. It's pushing paper, right? It's all the back office. It's all the billing. It's all the reconciliation. Hey, did we bill this person? Did they pay? Did they not pay? Send it to collections. All that stuff, which frankly drives none of the outcomes we've talked about, or none of the outcomes we were expecting. It's 40%. And healthcare is somewhere between a $2 and $3 trillion industry every year in the US, right? So if you think about the numbers, sheer numbers between, all the different aspects of records management, billing, reconciliation, etc., that's $1 trillion that probably is not being very well spent, right? There's a lot of opportunities there for automation, improving efficiencies, improving, frankly, customer service. If any of any of your parents have had to deal with, billing errors in Medicare, in the medical sector, that is something that you pull your hair out, right? And I don't have much anyway, but it's something that you just can't deal with without losing your patience. It is painful, it is inefficient, and frankly, there's not always a good outcome, because it's like there's bad data there. And then finally, again, a lot of systems up here on the left side, in kind of rehab, recovery, a lot of monitoring. Again, we have a model where people are doing more outpatient procedures, for example, but then they go home with either some equipment or some requirement to report back on kind of how they're feeling, how different metrics are, and so on. That's another set of data that kind of comes back and needs to be aggregated, analyzed, and so on. So just think about, with the patient in the center of all this, there is a huge amount of data that's being created, that's occasionally being shared, frequently being mishandled. And that creates, again, a lot of opportunity if you do it well, but also has some risks in terms of how it can be protected and how it can be compliant with regulations and so on. And then this is where there's thinking about, for example, someone who is insured. Their journey, it's a pretty complex journey, right? It is, you have a lot of interactions that you have to have with your insurance company, your physician, your labs, your et cetera, right? And throughout that, there's a lot of opportunity to both improve the experience, leverage the data better, and drive, a much better set of outcomes, back to the point that we were discussing earlier, right? So, anywhere from leveraging data, data-driven innovation, and kind of how claims are processed, right? Claims sometimes would take 45, 60 days, and you forget what that bill's for. And sometimes the bill that comes from the insurance company, almost by design, is kind of confusing, right? And, the ability to make that more real time, make it happen so that people can understand, oh yeah, I went to the doctor yesterday, this is what they did, this is now the claim is coming, this is what my insurance company is going to pay, this is what I need to pay. that level of cost transparency and making it easy to understand and making it not a almost by design opaque model is super critical and huge value, right? To us as patients, and also to those of us who are paying the bills, right? Whether it's a company, whether it's us as insurance subscribers, that transparency becomes of tremendous value, right? And there's a lot of work being done to help improve that. Then, as you engage with, that's more the billing cycle and so on. But you may also have, I want to set up an appointment. I want to change my appointment. I want to, maybe come in and set up a vaccination appointment and so on. Most of us end up falling into a call center, right? And it's got some kind of a voice tree that says press 1 for this, press 2 for that, press 3 for the other. It's also frustrating. Often you have to repeat yourself. It's not always the greatest quality. So there's a lot of work being done around natural language processing, right? And frankly, I have in the time I've been in the US last many years, I've seen a huge improvement in kind of how that's being handled, and the number of errors is going down, and kind of the systems are getting much better at handling that, right? And then ideally it goes into a call center where usually it's a person, but by using AI here, you can also improve that experience, right? Rather than having to repeat everything you told the prompt 15 times before you got to a person, this person actually now knows who you are, knows what your specific issue is, knows kind of where you're coming from, and can really optimize that that engagement, that experience by having history. Like, hey, this is Francis. Francis has called a few times. This is the issue we're trying to resolve for Francis, and not have to start from scratch every single time, which, by the way, for many, many years has been the norm of that kind of experience, right? So that's really both driving a better, both a better experience, but also, frankly, by having things like this, the cost of serving a call goes down dramatically. And I have an example later that shows what the delta is, but you can save 80-90% of the cost, right? If the person spends a lot less time with the patient on the phone because they have a lot of information already, they can direct them faster. Guess what? That call, they can go off and process someone else's call rather than trying to spend so much time repeating themselves over and over again. So there's a opportunity to kind of change that business model and be a lot more efficient in that realm. Then there's also a lot of what we call operational efficiency, right? We talked about the fact that 40% of those costs sometimes are administrative, right? If we can bring it down from 40 to 30, okay, on a $3 trillion spend, that's $300 billion that can be applied elsewhere to do much better on outcomes and better on funding research and so on, right? Rather than spending it on, frankly, again, pushing paper. So operational efficiency is our code word for basically saying, hey, make that process more efficient, make it less repetitive, make it more digital, less paper intensive, more automated, all those things that can help reduce both the cost while still improving member experience, right? And that's, I guess, I would say one of the key things here is, again, those of us who've been through this process, it's never really fun. And how do you make that so that it feels like all the other things we experience, like, calling an Uber or ordering something on Netflix and so on. These are easy experiences. These are things that have defined kind of what a consumer experience should look like. When you deal with the healthcare system, not quite there yet, right? So how do we help make a better mobile app so that when you engage with your physician and you have maybe a virtual call, it really is a good experience. It doesn't say, yeah, I'd rather do this again, so I don't have to drive to the clinic and so on, right? So a lot of work is being done on helping shape that part of the journey, really with the focus on what we call the consumerization of healthcare, right? And driving a much better experience, and with that, hopefully a much better outcome as well. So those are some of the things that are, going on. And as you can tell across all this, I didn't go through every single block here, but there is a number of both technology-based improvements, And this is where, Julian, when we were talking earlier before we started, there's an intersection between technology and really the business, right? Technology, this is not technology for the sake of technology. It's technology being used in the context of the healthcare business, the healthcare process, and how to make that more efficient. Any questions, comments while I take a quick water break?
I got a quick question.
Yeah.
And of course it's I think I know the answer. So insurance companies by design want to make those bills or those forms more difficult to read. Does that not cost them more money to do that too in the process?
It's a, as always, a very insightful question, Francis. And I think the answer to both is yes, right? It does cost them more, but if in turn through that process, they can get more out of the patient, they can get fewer questions, they can get people basically just throw up their hands, right? Say, I'm not even going to try to figure this out. Let me just pay the bill, right? And so there's a bit of a perverse incentive to do that. And again, I should be careful what I say since it's being recorded, but I do feel like there are some two bills from two different insurance companies, right? It's almost like they're in two different languages, right? The terminology, how they're laid out, the level of detail, etc. It's a again, back to the level of standards. It's really not done to make it easy for the consumer.
That should almost be illegal, I think. Like that's actually that seems like it's borderline illegal. That's almost bad business practice. Better Business Bureau stuff should be stepping in for this stuff.
Oh, trust me, I'm sure people file those complaints all the time.
Right? Because that's just shy of essentially just shy of conning somebody.
Conning, yeah, yeah. No, it's and I saw some heads nodding. I don't think I'm exaggerating by much, right?
Mm, okay. I just feel like that for that to go on. I mean, if we can require, cigarettes to put down this is hazardous and could
Yeah,
cause you cancer,
yeah,
why are we allowing this to happen?
yeah. And again, I think it varies a lot by region and which firm and so on. But it is I know, and I have to say I've been through that process myself, and it causes headaches, right? It's not trivial to figure out, um, you know, what was paid, what's the copayment, what's the deductible. There's so much lingo, and someone who's smart and sophisticated has trouble interpreting that. Imagine, someone who's got a serious health condition is getting all these bills, trying to reconcile, and frankly, they're really quick to send it to collections, which is why, unfortunately, again, healthcare is one of the biggest reasons why people file bankruptcies in this country. Right. All
Mm.
right, let's make this less of a political discussion. Otherwise, I'm getting in trouble here. So let's talk a bit more. We painted some examples very briefly, but let's talk a bit more. Let's go deeper into the impact of data and AI in healthcare, right? And here, again, I'll use Google and Google's technologies as a bit of a backdrop, but this is happening more broadly. There's a huge number of companies and investments are happening in this space, whether it's from venture capital firms, whether it's from corporate venture investments, from some of the large organizations. And it's an area of tremendous amount of focus, mainly because of the things we talked earlier around kind of how by changing it, by improving it, there's a lot of value that can be unlocked. So just to quickly again level set on this, first off, data is, we fundamentally believe, is the core to driving innovation, right? And again, we gave some examples, but think about all the different touch points, right? So first, in kind of the clinical side, right, the clinical and operational analytics, how do I make better decisions? How do I look at the data across a number of different procedures, for example, or processes, or volumes of data, And not in just an academic sense, right? Because there's a lot of academic data and academic research that goes and does great studies around that. How to do this on a more regular basis, right? These at the end of the day, whether it's a nonprofit or a for-profit organization, you want to make these really data-driven decisions, right? So that clinical and operational analytics is a huge part of where there is room for innovation and improvement. And there's a lot of work being done, but there's way more still to be done. Two, it's around the patient, right? It's we talk a lot about outcomes, but how do we make sure that we're using analytics and again aggregating in that flow, circular flow I showed, all those different sets of data from my wearable, from a monitoring system that may be in my house, from my visit to the lab. How do I bring that better together and say, hey, for this person, hey, there's some correlation we're seeing here. Their weight has been trending upwards. Maybe their diabetes is not really under control. That's a pretty basic example, but we need to do something a bit more preventive on someone like this. They're pre-diabetic and their weight trend is simply not going down. Well, that kind of data, that type of, and oh, by the way, from the wearable, I can tell they're really not doing any exercise, right? That's kind of a combination of factors that say, potential problem coming, right? So how do we get ahead of that and have a conversation about, look, here's what the data is telling us. You're really not putting enough time into your personal care, and we'd like to help drive rather than you getting further down the path of diabetes or heart disease. How do we help you get ahead of that, for example, right? Again, I'm using very basic examples, but you folks get the picture, right? And then finally, we talked quite a bit about patient experience, but again, how do we make it much more of a true consumer-like experience, right? How the advent of mobile devices and handhelds and so on, we have such a great experience, in ordering food from a restaurant and ordering an Uber and again getting on an airplane. But again, when it comes to healthcare, it's not quite there yet. So there's a lot of work that's being done on kind of making that into a much better experience. So the other part which we started to talk about as well is there's no lack of data, right? Healthcare has been very data rich, and data here can come in a lot of different ways, right? So there's medical records, there is x-rays, there's CAT scans, there is images that have been done over time. All those things in my definition here and in our lingo, that's all data, right? But they tend to exist in silos. They're not brought together. Now, some of it's because there's different entities, right? The healthcare system itself is pretty fragmented, right? So you may have a clinician who's part of a medical group. You may have a hospital that's part of a different organization. You have labs that are third-party labs that are doing that as a service. So they're different systems, different organizations, different entities. So therefore, they have some restrictions on what they can share, right? Second, there's compliance, right? HIPAA is in place, and there's unless someone permits, that data cannot really be shared without the right kind of protection and agreements in place, right? But having said that, even if I did permit someone to share my data, right, it still is very siloed. It still doesn't, it doesn't talk easily across systems and organizations and so on. So that creates a big challenge, right? And then also, again, because of volume, because of design, because of compliance and regulations, often there's also issues around how electronic health records and other systems are exposing data. There's standards like FHIR that's come around in the last few years from HL7 and F, by the way, stands for fast, right? And the idea is, hey, how do you get data shared quickly? And it doesn't, as much as all of us were, vendors and technology providers in the space are trying to help facilitate that, it still is hard, right? And not everybody's adopting the standards at the same time. There is flavors of the standards. There is, variations of it by type of type of data? Is it a image versus a health record versus a maybe a data from wearable and so on? So that creates a lot of challenges in terms of how standardization, how is it being attempted, but not always being executed. And here, frankly, I think there's a tremendous contrast between the challenge we see in the US. And I would think, I know for a fact that the UK with its NHS, National Healthcare Health Systems, they have a much better ability to do this because they are centralized. And here, and Francis knows this probably better than any one of us, the VA is an amazing system that has this data, has this visibility. And people look at VA, they look at Kaiser, which also Francis knows well, as examples of organizations that have done this at scale. So the point is, it can be done, but it requires willingness. It requires an organizational structure that enables it. And it does require some of these silos to be broken down because without that, the value of it kind of coming together in what, call the longitudinal view, which is really connecting all these in a way that says, hey, here's a patient, here's all the different data sets, here's the ones that have allowed us to share and analyze and compare and so on. We're, it's a lost opportunity if we don't really enable that in a more regular fashion. Francis, any comments on that? Since again, this I've
I
alluded.
definitely do. I definitely another one. What would happen, and from a theoretical point of view, if the government just, since we're in the age of mandates now, like vaccinations mandates,
Mhm.
if the government made a mandate to all the major healthcare, like like Kaiser or Sutter or all the large care facilities, and said, we have to come together with a standard across the board, and 1 year time, this is whatever happens, this is the standard we're going to go with, and this has to be something that every EMR system that you adopt, I don't care what brand you use, it has to be to talk this language. And if you don't, there are going to be tax penalties. There'll be major tax penalties every year, increasing it until you all get on board with this.
Well, so again, I think in concept, I would say that could make a lot of sense. I think the attempts to create the standards, whether HL7, which was created, by the way, in the UK,
Yep.
and others, the attempts have been there for a while, right? I think two things, frankly, get in the way. One, quite honestly, because there's been different forms of technology have been deployed over time, trying to flip that switch and saying, hey, all of a sudden, everybody's going to, have access to a fantastic new standard. Um, it's virtually impossible because we may have some, I may be Kaiser, I may be Sutter Health, I may have some system I deployed 20 years ago that's still doing what it's supposed to do, but it's not easily open from a technology architecture perspective for it to adopt a brand new standard that is, or even an existing standard that it has not worked with before, right? So the systems work, and it sounds like an excuse from a technology vendor, right? But the systems work required to do something like that is massive and it's painful, right? And that's where a lot of, very, very large organizations like Accenture and DXC and Deloitte and KPMG and others, they make tons and tons and tons of money trying to make those things progress. But it is, I have to say, it is a hard problem from a technology perspective and a systems perspective. It's a hard problem, number one. Number two, again, delving into a bit of the politics of this, right? Mandates don't seem to, it's easy to say from the top, but we live in a country where, states have power, and there certainly seems to be a divide, even for something as basic as something for the common good, that everybody should get vaccinated with a vaccine that seems so effective. There's people fighting the mandate because they don't want someone to tell them what to do, right? In healthcare, I think, if you extrapolate from an issue of one vaccine to a broad, hey, your data is going to be shared, and the mandate is you're going to use the same technologies and etc. I think there'd be a massive pushback, both politically and frankly, even from some of the health plans and so on, because I think right now they can treat this as a bit of their own view of the world. There's the incentives have to be in place for them to really open them up. So I think it's a bit, candidly, I think that it's a bit altruistic to think that that can happen here, and unless we have a universal healthcare system.
Which, yeah, you probably know where I stand on that. Just waiting for that forever.
Yep. Yep. Questions, comments from the other folks? You folks are quiet, so I'm trying to make sure. Is this
I want to hear from
narrative?
Mia, who lives in that universe.
I mean, I feel like I say like the same things every time, but just I don't know, the comparison is really vast. And I can't imagine what it's like to like live in the US, especially without insurance. Because like you have something to fall back on. In Canada, it's just that like there are also cons that come with it. As I've spoken before, like wait times are always super long, even if it's just for like a super general like family doctor appointment that you make ahead of time. Sometimes I go and still have to wait like 40 minutes just to see the doctor. But I don't know. I guess there's pros and cons for both.
Yeah. No, and look, no place is going to be perfect, right? But the fact that even if it's a 40-minute wait, you get to see a doctor, and that let's take the example of someone here in the U.S. who's unemployed. Right here, it is a employment-based insurance model. So if someone's unemployed and they can't afford COBRA, which is the only available insurance to them, and this is again pre-Obamacare and so on. Obamacare has improved some things, but a lot of people don't even have the ability to just wait for it. There's no place to wait 40 minutes, right? Because there's no care that they can get other than the ER or urgent, right? Which is how, unfortunately, the system is set up. ER cannot deny service, but again, it should be for catastrophic or critical issues. But for someone who wants to just do a preventive visit to go see a general practitioner, that they don't have access to that, right? So that's part of the problem. Is it's a employer-based healthcare model, and that frankly leaves a lot of people who may not be, they're not unemployed by choice, but just as one example, unemployed folks is one that you have to think about as a sizable contingent, and their families who don't have access, right? So, and again, I do say, and I have to say, there's a lot of studies that show this. The VA, Veteran Affairs system, is considered to be one of the best. Yes, it's got challenges. Yes, it's got resource constraints. Yes, it's got a lot of issues. But as a centralized system, it's considered to be one of the best in the world. Francis, am I?
Yeah, absolutely. My friends who work there, they have their complaints that it works. It actually, and no matter where you are, you could be a veteran in New York and visiting out in California, and they can pull out your records.
Yeah.
Right there in the spot. Totally centralized system. And that's what drives me nuts, is the fact that this is not like this is a pie in the sky. This thing exists here in our
It can be done.
backyard,
Yeah.
right? And we literally just have to duplicate it, but it's politics.
The mindset has to change. And it's not just a systems problem, right? I mean, yes, the VA, the system they put in, just Kaiser did, and even NHS, it's Epic. And Epic has been has become some of the standard for this. It may not be the best system around, but hey, it exists, it works. But system is a piece of it. But I think the mindset of
So it's very funny.
So those kind of issues kind of, hey, Francis. So those kind of issues of differentiate, proprietary systems, proprietary design kind of, again, become critical. And again, there's systems that don't work well together. So how do we convert? How do we make all that? And then finally, and this is one thing we have not talked much about yet, but if you think about, people in the clinic, whether it's a nurse, nurse assistant, a PA, a physician, they're not systems people, right? That's not their vocation. That's not their training. That's not what they wake up wanting to do, right? And we start pushing so much technology, so many systems. They need to be trained. They need to be retrained. They need to, feel comfortable using those systems. So there's a big people issue. And in the consulting world, we call that change management, right? How do you help someone who's been doing certain things a certain way? They had a paper clipboard, and that's how they took their notes for decades. Now all of a sudden you're saying, hey, log into the system. It's got 30 tabs, 15 screens, and you got to authenticate first. And then through that, you have to do everything you do with your patient, right? And that's a typical experience for an EMR. In fact, my own physician, he's a old school person. He's like, this thing really is a piece of crap some days because it's slow and things I could just jot down and my assistant would submit later. Now I have to do it here. I have to wait for it to make sure it logged my request and so on. Those kind of things are part of the challenge as well. And that's where we talk a lot about the experience for the patient, right? That it needs to be more consumer-like and more like Uber and whatnot. It also needs to apply to the clinicians, right? The nurses, their job is to go help the patient, not to enter 50,000 pieces of data in the system, right? So kind of how do we make that process more automated? How do we gather data from these other systems without creating a really, really bad experience of the people who are, there to do, frankly, do another job. But systems kind of become one of the impediments for things to work. So what we're doing at Google with our partner ecosystem is really looking at this pretty holistically, right? And think, hey, how do we map this all out and think about this from the point of view of all those different touch points and look at this as if we had a clean slate, how would you try to do it? So we launched recently something called the Healthcare Data Engine. That's really the kind of the mindset of saying, hey, there is a centralized view that, again, to Francis' earlier question, we are using some of the standards to bring the data in and so on, but trying to make this such that, across claims, which again is where the money flows, across the patient view and the patient 360 view, all the different touch points across all the different physicians and labs and clinics and so on. How do we make the data work together? How do we drive that operational excellence, which again, there's a huge amount of waste that can be unlocked if we do things more efficiently. How do we look at population health, right? And here, the last 18 months have shown that there's a huge value. And one of the examples I'll show later kind of goes specifically into that, is how do we do this not just at the individual patient level, but at their community, at the broader population? Hey, how do we know when the Bay Area or different counties in the Bay Area have reached a level of, combination of vaccination plus people who've had COVID, that we are actually, above 75% or 85%, whatever the right number is, that feels like this is herd immunity, right? That's population health. And if we had right now, those analyses, and I know people who do those, they're challenging. You have to get data from different county systems and private hospitals and reconcile those and so on. Shouldn't that just be more automated? Shouldn't this be more seamless for it to kind of come together and say, yeah, we're, whether at California level, whether at county level, whether at city level, et cetera, here's how we're doing, and here's kind of the aggregate for different parameters, right? Omnichannel is lingo for, hey, we don't sit in front of a desktop every day. Sometimes we're on the mobile, sometimes we're on the desktop, sometimes we may be on an iPad, sometimes we may be inside the clinic. Any one of those, we should have the same experience. We should have a good experience, right? And the data should not be such that, hey, I can only get access to some certain information when I'm home in front of my big desktop or something, right? Can I get a version of that on my phone, on the move, on the go, etc. Right? So within the realm of providers and payers, right, clinicians and insurance companies, there's a lot of work that we're doing to try to reconcile the data, create a kind of more of a common data model, and see if we can drive some of those improvements we talked about. But then there's a big piece that we haven't touched on much yet, which is on the right side, the pharma sector and the medical technology sector, right? I mentioned early on in the discussion, hey, a lot of these devices now are plugged in as well, right? So MRI machines, et cetera, these are no longer standalone. They're really, just like a computer, they're plugged into the network. Well, trying to work through all these, right? Kind of how do you drive improved research and development productivity inside pharma? How do you kind of help manage clinical trials and make it more efficient, right? Again, the experience that Pfizer and Moderna and J&J have shown in the past year by running, pretty world-class clinical trials in a very compressed amount of time, providing the data back to the FDA here and other agencies in other countries, and really making this, frankly, what most of us who live in this world never thought would happen that quickly, right? This was almost felt like a miracle, right? How do you make that process even better, right? Because a normal clinical trial process for drugs is what, 7 to 10 years, right? Or vaccines. Here, within months, yes, there was a lot of research being done before, but the fact that they mapped the virus, they shared the data, they created the mRNA vaccines, and then did, very substantive and very validated trials, and then got early use authorization and then full authorization within a year. That is unbelievable, right? And there, kudos to both the scientists, but also kudos to the systems that helped make that happen and kind of drove it in such a way that there was a very, very high confidence that these vaccines would do what they were supposed to do, right? And then things like supply chains and so on, right? So there's tons and tons of areas where we are working with both partners, working with customers, and really trying to help rethink this in a way that allows us to get a bit of that nirvana state that Francis talked about. But I think we're still, a long ways to get there. But step at a time. I won't go through all of this, and I also want to make sure there's time for questions and so on. But let's just think about some of the things that we're hearing, and kind of how can we help address that, right? Not just us, Google, but practitioners as a whole. So, and I think this came up earlier, and I think one of the students is focused on this, right? Delivering quality care while helping to eliminate racial disparities in healthcare, right? This is a big issue, and it applies not just to racial discrimination, racial groupings, but frankly, economic groupings, like geographic groupings, people in rural areas versus urban areas, and so on. So there's a lot of work being done to kind of really map demographic data and understand how we can leverage all that information, whether from a clinical perspective, a social perspective, et cetera, and drive better outcomes, and kind of working with EHR data, aggregating it, normalizing it, looking at more demographic data. So it's not personally identifiable, but it's more at the group level, for example, right? So here again, driving health equity, right, and doing it in a way that delivers high quality care is super important. Another one that we're spending a lot of time on is, what are the care gaps that you can identify for a patient that may be, for example, in a clinical situation, a hospital, or in a outpatient situation, and say, hey, there are other things that we can help that drive more of a preventive healthcare model, right? So we've identified certain issues or trends. It's not something they're suffering from yet. Excuse me. But it's something that we can help manage beforehand. And back to the point of driving better outcomes, I think there's a lot of research and hard data that shows preventive healthcare is way more effective than trying to solve the problem after a patient is already suffering from certain disease or has different kind of symptoms. So if you can identify a certain pattern or trend and say, hey, we can do a kind of a pre-intervention and help someone think about either medication, lifestyle changes, etc. It drives much, much, much better outcomes, and it's ultimately better care. So that's the area we're spending a lot of. And then again, a big issue that has come up a lot, particularly last year, even more so last year, but has been a trend in general, has been around provider burnout, right? The lack of enough physicians, specialists, nurses, etc., has created huge issues, right? People are retiring sooner, they're getting sick, and frankly, that's unfortunately, we just have to say this, right? Within COVID, the number of casualties that were among the providers was also very high, right? So it's further depleted the ranks of providers. So how do we kind of provide better work-life balance and give them, again, better decision-making tools, remove some of that burden of the paperwork and all that overhead that can be quite time-consuming, and really allow them to focus more on delivering care, which is what they set out to do. Right. So this is some of the areas that we are working towards. Again, leveraging data, leveraging a lot of our partners to kind of drive kind of better outcomes across the board. And again, we have to consider that many of these at the end of the day are businesses, right? So from a business perspective, we look at a few things, right? As if we can achieve some of the key outcomes. One, interoperability, right? So I've repeated this a few different times, but just have to keep saying it. Kind of how do we make the systems work better together, right? The single mandate that Francis mentioned, I think we're a long ways from that. So in the meantime, how do we kind of translate from a system to another? How do we make sure the data is, even if it's in a silo, it can be appropriately reused or repurposed, translated, and be consumed elsewhere, right? So that's a big part of what we're trying to do. Again, as Google, data has been our core, right? So how do we drive data-driven innovation, right? We have tons and tons of research, not just within healthcare, but across the board. How do we look at data in huge volumes? How do we look at it very, in rapid aggregation, find patterns, and really then bring that into different solutions, like all the things that we've been describing, and make it come to life and help you make better decisions, or help both patients and clinicians and providers make better decisions, right? The operational efficiency, right? Again, how do we automate things that should not be manual, that should not be paper-based, right? Reduce that overhead and save tons and tons and tons of money that can then be applied in driving better outcomes, right? So that is, in any large organization, whether it's, again, Stanford Healthcare, whether it's Sutter Health, Kaiser, etc., that there is inherently history of doing a lot of this with kind of arcane old manual processes, and kind of how they've evolved. But now there's a lot of work being done to help automate and reduce the kind of the friction of bad processes, right? And then finally, certainly the top of the pyramid and most important core theme here is empowering clinical leaders, right? Physicians, nurses, etc. How can they make better decisions? How can they help drive better outcomes? And how can they use data in a way that, leverage all their training, their insights, etc., and then support it with data and say, hey, here's really what's going on with this patient or this population or this segment at large, and help them make better decisions around that. So here, just for kicks, I had mentioned this earlier, right? But here's currently just a sampling. It's not a complete list. Here's a sampling of all the different compliance requirements around data and healthcare data that, if you're building an app, if you're building a solution that you have to comply with, right? And I wish I could say they all are consistent. They're not, right? And it becomes a big part of what those of us in the tech sector have to deal with on an ongoing basis, is making sure that as we design products, as we build our infrastructure, as we work with partners, etc., that all these different things and many more are available, they work, they're kept up to date. If something new comes around, how to make sure that gets incorporated? It's a lot of work, right? And the same product, ideally, is being used in different geographies, different countries, but it may have conflicts, right? Some things may be shareable in one market or in one country, but they're protected in another country. Well, you got to be able to align with that. So this is not to discourage anyone. Julie, I'm looking at you from building applications and building products, but it does require understanding and thinking this through. Now, the beauty of it, candidly, it's somewhat self-serving, but folks like us or Amazon or Microsoft and others, we've spent billions and billions of dollars to make sure that our kind of core products comply. So ideally, if you're building on top of that, there's a pretty good chance you'll be complying with the guidelines and regulations and laws. But again, it's a fair amount of things that have to be put in place. And healthcare and the two areas that get a lot of scrutiny are healthcare and financial services, right? So you just have to be very thoughtful about how to use data, use AI, and then build products on top of that. All right. So what I'm going to wrap with is 2 or 3 examples of how all these things I've talked about have come to life in real customers and real life situations. Okay. Before I go there, any comments, any pauses, any feedback, anything that's burning? No? Okay. All right. So first one. So this is I can't name the client, but it's in the Midwest, a very large healthcare provider. And they were really trying to figure out in the early days of COVID how to plan, how to make sure they had the right staffing, the right skills, and understand where they might have some challenges in the different parts of the hospital, including the ICU and so on. So one challenge for them was timing, so data latency, right? So Epic, I mentioned earlier, is the kind of the most of the EMR of choice for most large hospital operations, provider operations. But in the case of waiting for 24 hours to get the data out from each different location was simply not effective, right? Things are moving so quickly. You had to plan literally kind of on a daily, hourly basis almost. So one of the things we helped them do was, again, using HL7 as a standard, brought the data, in a much more real-time way, and they could see in across their whole region across all their locations in real time, what the level of incidents and cases and what type of specific things are happening, so they could plan for, delivery ventilators or ICU beds and so on, right? So huge impact from going from 24-hour-old data to kind of really in real time, right? Secondly, again, this is a common theme, even within the same provider system, right? This is one single entity that owns all these places. Even then, each of them had their own siloed data, right? They're running a system running inside their their server room, if you would, right? So here, what we helped them do was aggregate that, right? Now they had the authority to do it. It was their own organization, but required some quick work. But bringing it all into a single integrated data set from within the organization allowed them to plan better. That said, hey, I have capacity, I have beds in one location, I can bring patients from this other location that is running out to this first one, and kind of really manage that in a much more efficient manner. And then third, we talked a little bit about skills on the provider side and kind of helping retrain people. There's also not enough IT skills, people who understand how to make sense of all this data, who can say, hey, this is what, if I'm aggregating this, I can look at it in kind of my whole region. I can drill down into, hospital 1 versus 2 versus 3. Here's what it means. So we've helped them build a whole bunch of dashboards out of the box that a head of a hospital or a head of clinical services or a individual doctor could look at and kind of look at their respective local data, look at it kind of more aggregate and see trends and so on. So this was done, I think, if I remember correctly, this whole thing was done within like a week or 10 days, right? This was the benefit of having, an organization like Google with resources and expertise, and really coming in and saying, hey, we can help almost as a public good and a public cause, help you solve this, very, very quickly, right at the beginning of the pandemic. This one is a different client, and the problem was a little bit different, which was a lot of data, right? We briefly mentioned this earlier, right? You have Word documents, you have PDFs, you have images. How do you kind of make sure that we can aggregate these and kind of work with them together? So here we used a big part of our AI engines to kind of really look through all these different types of documents, extract from that the right information about medication, about medical conditions, about images, etc. Brought it all into one data warehouse, right? With both, as we would call, unstructured and structured data, and then said, hey, now we can apply a lot of our models around that, and then analyze the data in a much more aggregate way, right? So this was a longer cycle. This is more for population health as well, but it helped bring all these different sets of data into a single environment or data lake, and then start building reports and analytics on top of that, right? So you can start seeing, conclusions. We're seeing a drop in patient quality outcomes for diabetic population Northeast, right? So now we've gathered all this information. We're correlating between different medications for diabetes and so on. And now we can say, there's a huge number of cases, 1.1 million, and the outcomes, it's not declining the rate of diabetes in this population, for example, right? So these are, big issues, right? And you can start identifying patterns, identifying programs, identifying healthcare initiatives to help tackle. Okay. I won't go into this one. It's very similar, right? Again, a similar idea of trying to bring different data together, different client. But again, this was a bit more specific around, I can't remember the actual situation, but very, very similar idea. And then, we briefly talked about this earlier, but how do we improve the experience, right? Hospitals were their phone lines are blowing up. I got to come in. I got to here's a situation, here's the symptoms, etc. So in this particular case, we deployed virtual agents, right? The hospitals didn't have enough staff to get on the phone. So through virtual agents, it was a human-like interaction. And as people describe their conditions, they could be routed and triaged on the phone, right? Rather than having to wait for a human to come on, right? And that improved both the experience and frankly allowed this particular client to help segment between those who truly needed urgent assistance and needed to come in versus those who could perhaps stay at home, isolated, so on, right? So again, during a pandemic, a lot of extra activity and the requirements, and using technology to help manage that, and it reduced both the burden, the stress, and frankly helped focus on the case that needed the most help. And then finally, this is the last slide, and here again, one of the things that my team's focused on really is working with some of the large customers who also have very unique skills, and someone like a Mayo Clinic who's known worldwide as one of the top healthcare organizations, right? So we have a 10-year partnership with them, and they're using our AI to really build very, very precise treatments, kind of personalized treatments for of a number of different situations. And here's an example where in radiology, right, what used to take 4 days was get down to 20 minutes because of data algorithms and pattern matching and so on that could detect certain conditions, certain situations, from 4 days to 20 minutes, and reduce the cost from $500 to $5, right? This is where you can see massive impact, right? So what's really going on here? Mayo Clinic has obviously tremendous expertise. They're using that expertise to tie back in with a lot of data, right? And their CIO, Chief Information Officer, basically said, hey, with this platform, with all the security and compliance, we're using some really amazing AI and revolutionizing healthcare delivery, right? So personalizing that for very specific situations. That's an example of where, sometimes give me chills just to see the kind of impact you can have by both saving time and money, but ultimately really it's about driving better impact. And then Highmark, another very large hospital chain. Here we've built a 6-year partnership with them using a lot of our core products. And again, more personalized experience. We talk a lot about experience, but delivering that in a way that kind of really delights them and reduces a lot of the burden on the physicians and the providers, right? So kind of really taking a lot of the administrative burden out of the way. So examples of where new technology kind of coming together is driving, much better outcomes and a better experience for those involved. With that, Francis, I'll turn it back to you. I have a few more minutes, but happy to open it up for questions, discussions, etc. But I wanted to first and foremost thank you all for taking the time and paying attention.
Awesome. Can you hear me okay?
Mm-hmm.
Awesome. All right. Thanks. So thanks again, Avanish. Yep, it's a very depressing slide for me because it's telling me all the things that could be and that are still not. And it just, for me, it's always been so hard it's human ignorance or stubbornness or psychology that's preventing us from giving more accessibility to people that need to care, especially when we have it to give in the first place.
Yeah, that's look, I am an optimist by nature, so I'd like to think of it as glass half full and say, hey, yes, with the right will, with the right leadership, the right investment, we can come out of this. And frankly, one thing I just have to say, and it's super important, the US still is the global leader in anything and everything related to healthcare, in terms of research, in terms of medications, in terms of procedures. There is no other country. There's no other country that is as far advanced as we are, right? So we can't, we can't punish that, all that thinking, all innovation. We talk about Mayo Clinic and others. I mean, people from all over the world come to the US for particular treatment, right? If they can afford it, like whether it's Cleveland Clinic, Mayo Clinic, Mass General, etc., Stanford. But having said that, I think the political will and some of the and again, I try not to make this into a I bash the insurers, but there's an economic model that's been put in place where the incentives are not well aligned, and someone has to have the willpower, maybe and the political power to kind of crack that, because the insurance companies, I think, play a massive, unfortunately, they do play a big role in kind of being gatekeepers to some of the changes here. And
Um,
that's a political statement that I'll stand behind.
no, I 1% agree with you on that. I want to also take, unless, does someone have any immediate questions right now for Avanish before I ask another question? Julian?
I thought
Yeah.
Chloe had raised her hand, but maybe
Oh,
not.
Chloe. Yeah, please, Chloe.
Oh, no, I didn't have a question. I was like trying to do the clapping emoji after the presentation. So.
Thank you.
Do you have a question at all, Chloe? Especially as future doctor?
I'm still trying to like internalize everything, and then I'll ask the question in a bit.
Yeah, no worries. I covered a lot of ground, and some of the terminology may not be familiar to some of you. So again, please ask for any kind of clarifications.
So, all right. And unless I would love to hear more about your view or your concern about science and its place in the community right now. We talked about that over dinner a little bit, but I really wanted to have it where it has a better impact here with the future generation, because I think that population should hear this.
Yeah. So thanks, Francis. And it's a complex point of view, but I'll try to distill it, right? So just by way of background, I didn't go into the details, right? So I am born in India, raised in Brazil, and have a engineering degree from Brazil in electrical engineering, very similar to what Julian's doing. Came to the US to get my master's in engineering. And at the time, it was not even a question, right? That for computer engineering, electrical engineering, or probably any kind of engineering, the place you came to was the US, right? And I went to grad school in Boston. And I was like, it's a no-brainer, right? The US this is about science, it's about innovation. This is the place where all of it happens, right? And then from Boston, I moved out here to the Bay Area. I had an offer from Oracle, which was a relatively small company at the time still, only 3,500 people. I think now they're over 150,000. But I just thought, I love the Bay Area, and it was some really, really smart people say, yeah, this is where I'm gonna move to. But throughout that, the mindset always was, the US, whether it's Silicon Valley, whether it is the biotech corridor in Cambridge, Massachusetts, all these places, this is where science and innovation rule, right? This is where the country is built around this element of education as a whole, and particularly science and technology, right? And again, yeah, there's some countries that have done a few things, but if you look at the universe of the day-to-day stuff that we consume, whether it's an iPhone, whether it is digital cameras, whether it's the computing equipment, whether it's digital imaging, all those things, right? They've been typically innovated in the US, right? The brands that we think about that are top in innovation, it used to be IBM and HP. it's Microsoft, it's Apple, it's Oracle, it's Google, it's Facebook, it's Salesforce, right? They're all US brands. How many companies can we name that are not US based that have really transformed an industry, right? TikTok doesn't count. But so it's the kind of stuff that you say, the US is the heart of that science and innovation. And what Francis and I were talking about over dinner a couple months ago here at our house was the fact that what I have seen in the last few years, and again, this becomes somewhat of a political statement, but I unfortunately think it's true, is there's been a rapid, and it's been I've been in the US for 30 years, 32 years. So in my time here, I have seen a rapid decline from this passion for science, passion for engineering, passion for innovation to big swaths of our country where there is no longer a belief in science. There's no longer it's not credible. I got to go do my own research and all, frankly, crap that doesn't make any sense. And it's become pervasive. It's become supported by, particular politicians, and that applies to climate change. It applies to vaccines. It frankly applies to a whole slew of things that I never thought I would see the U.S. devolve in that direction, right? And the fact that you have textbooks in certain states that, frankly, science textbooks, I should say, that don't talk about or don't talk sufficiently about evolution, but they have to balance it out with creationism. That to me is a problem. And again, it's not a religious statement. It's really just a statement about science. In a science class, you should be talking about science. You should talk about data. You should talk about hypothesis proving, analytical skills. And what I'm sensing in the last few years is an acceleration of that process where there's kind of this less trust in data and science, and there's a hidden agenda behind all these different things, and that worries the bejesus out of me. So that was the context. Francis, I don't know if you want to, again, we only have a few minutes, but that can be a very long conversation.
No, yeah, that's and you can definitely see it in how much the nation was split this past year through what we were trying to do based on, I think, facts and discoveries, and then based on just opinions that people insisted were facts.
Yeah, and I'll give a quick compare and contrast. I did, Francis mentioned this way in the beginning, but I had spent 5 weeks in Brazil, and that's home for me. And Brazil was not the most advanced scientific nation in the world by any stretch of the imagination, right? But just use the vaccine or the COVID as a backdrop. When they did surveys with the population, 93 to 95% of the population around the country, right, no matter the level of education, said that as soon as a vaccine was available, they wanted it. Now, Brazil, if you followed the news earlier this year, had some absolutely disastrous outcomes. They're number 2 in the number of deaths officially. US is number 1, they're number 2. Their president publicly said that you don't need vaccines. This is going to just be a natural herd immunity. The best thing is to get it. And, if someone doesn't make it, oh, well, too bad. If they're old people, they should be gone anyway. I mean, I'm paraphrasing, but not by much. In spite of that statement, 93% of the people said, no, when the vaccines come out, I am going to get vaccinated. And it so happened that I had to plan this trip as a personal trip. We waited for a little bit. And in a 90-day period between sometime around May and August, September, some states there went from 0 to over 80% of the population vaccinated, right? And basically the population ignored their, core leader, followed guidelines from scientists, watched different science-based programs and said, once the vaccine is available, it works, it's safe, it's not going to come and, track me with a chip or whatever crap was being said. And they took it. And 2, masks. I was there for 5 weeks, and I have to say, I have never, not even in the Bay Area, not even in San Francisco, I've seen a mask compliance as strong as I saw there. Everywhere, people wearing masks. And things are getting back to normal. So point being, it's a country that may not be, again, known for its scientific prowess, but it comes down to leadership. And here, I just feel like we've somehow gotten into this divide that Francis mentioned, and it causes me a lot of angst.
Absolutely, yeah, me too. It's like I said, I think I always sensed it, but I didn't see it so clearly demarcated until this past year,
Yeah.
to where it made a difference in something that mattered in such a great, like the national health level, right?
Yeah, it's not an opinion, right? This can't be an opinion.
Yeah, exactly. And I think, it's one thing if you don't agree with, okay, fine. If you don't agree with evolution and one that, that's, I don't think I really care less, right? That's your opinion, that's fine.
Yeah.
But when your stance affects the entire group as a whole, then that ripples throughout the entire community, right?
Yeah, exactly. And it's not just your decision, right? It's you, then it's your family, it's your community, and circles keep expanding, right? It's not a.
Yeah, I mean, I like
So
does
yeah,
anyone have
this is just one of many examples recently where.
Yeah, I would love to hear some other people's opinions on at least what their observations were this year in terms of science and its place and I guess how we deal with such a stressful situation. From anyone. Julian, do you have what's your take on what you observed in terms of fact and science and oh, I don't agree with science type of stances that we saw so much in 2020 and 2021 actually.
Oh, well, so okay, I'm originally from Florida, and there it's a lot different than it is here. So in times of like COVID and other things like that, I would ask my friends back home about like how they felt about COVID, vaccines, XYZ things, and they were very strong on rejecting scientific fact, and it's a lot to do with like the idea of honestly a lack of like secondary education, because like a lot of people where I'm from don't go to college, and B, simply just how they were raised. And I feel like a lot of the country kind of follows on those two commands of, if I learned it growing up, I'm going to stick to that. And even with education, that probably also won't change. So with science and fact, especially if, for instance, like your government, like your patriotism is really strong in this country, like all those things combined really just take the idea of really diving into research, doing like the necessary things to know to understand the knowledge, to get your own stance and to like truly believe what's going on, just kind of go out the window. They're kind of just rejected. And that's why I'm glad I'm over here. But I can't say that for a lot of people where I'm from / a lot of just that area. And some people I meet here too, it's just, it's very apparent. And I think that is more localized for the United States than a lot of other countries.
Yeah.
You know? So I think it's not going to stop, honestly. And if it is going to stop, then it has to start in the beginning years of education and stuff like that, which honestly need a lot of work.
Yeah, no, I mean, that's I will say, Julia, I'm 100% with you. And I look at, again, to compare and contrast, right? So we've been this paragon of education and science all these years, hundreds of years for the US. But now you start looking at South Korea, you look at Israel, you look at Singapore, right? These are relatively young countries. They're all actually young countries.
Mm.
And and they have re-emphasized their whole future on core education, and not just science education, right? It's not about just STEM. It's not just everybody has to be great in math. I mean, it's good, but that's not only it.
Mm.
But it is about education, and I mean, that is the core of what when Francis and I were talking about, is that's the part that concerns me the most, is that we seem to have lost our our way around the focus of education. And by the way, it is completely agree with you. It's through all age groups, all
Mm.
age groups.
Yeah, my my high school experience versus many other people who go to Berkeley's high school experiences are vastly different. I got education from like an island in Florida. It's very not great.
Yeah.
And then my friends here like went to like top 10 public high schools in the country and XYZ things. And
Yeah.
A lot of them came here. I'm the only one that came here from mine. And everyone that I've met from theirs, they have kind of definitely like a besides the point, but just like a lot better skills for original thinking and other things like that.
Yep.
So yeah, and plus, I'm also cognitive science, and so like for the past 4 years, I've been like learning about the brain, neuroscience focused, all those things.
Mhm.
And one of the things I've learned the most is that the education system is like broken. It's just yeah. So I don't know. A lot of
It's a
steps.
big, it's a big, huge issue.
Yeah.
We talked about healthcare, which is massive most of the time today, but yeah, education is another one that has got,
Yeah.
there's a lot of room for fixing and improvement. No doubt. Hey, can I just ask you one thing, Julian?
Sure.
You broke my heart a little bit by saying you don't think there's a fix. If there were to be a fix, where do you talk about elementary education and so on. Any other ways that this can, the needle can swing back a bit more towards the middle or the rational?
Well, okay, yeah. I think I think there's a lot of cultural issues, to say the least. And like 100% education is strong in that a lot of times there's not really a motivation to continue with education past high school,
Yeah.
even to complete high school.
Yeah.
And that I think is a part of a cultural thing, because I know like a lot of friends of mine growing up would go to their school counselors and they'd just be like, oh, like college doesn't seem right for you. And like it's the adults that are like telling you no. And it's also like the parents who are saying like you can just stay here and do this and do that. And that's one thing, is if you're staying in the environment that brought you up to kind of culture this idea that these are the belief systems you should have, like thinking outside of the box is like a little bit of an outstretched concept, and you stay in that environment, it's not really going to change, and then you're just going to perpetuate that idea and like further just kind of pull that along. For a fix, it's hard. It's hard. I think that social media helps in really weird ways. I don't necessarily agree with a lot of what it does, but to be honest, it debatably educates the younger population on definitely a lot of dumb things. Don't get me wrong, but it has some good things. It's not all like propaganda nonsense, and I can appreciate that. Like that, I've seen like a lot. I remember knowing that before like TikTok or something came around, like the rates for 18-year-olds to participate in elections were just like extremely low, and they raised drastically after like TikTok came around, and that's like phenomenal, So like that's part of the fix. I think another part of the fix is, I honestly just believe it's also education, and like putting a positive view towards it. It's just that's just like one of the most broken systems I've seen. I've seen it fail so many people, and it's just like ridiculous.
Yeah.
Yeah. It's all.
Yeah. Again, you're nailed it.
Yeah.
The only other dimension I would add is I think there's and this again is somewhat unfortunate but unique to the US, is the cost of education
Right. Yeah.
should not be a factor.
Mhm.
And here it is, right? And here affordability, whether even if it's your regional community college and so on, it just, well, community college, I take that back. Those are generally they're subsidized, but the cost factor scares a lot of people away.
Mhm.
And the amount of debt that's good. And again, I don't know of any other country where a higher education costs what it costs here.
Mhm. That's why I mentioned that there's a lack of a fix. Kind of is, I just don't see the change coming, and it's not being, it's like being defunded as
Yep.
as it goes on. I remember in 7th grade when I was in like my English teacher's class, and he was explaining to us how like their salaries were getting cut and all these things, and I was like, if you're not incentivizing the teachers, they're going to be like less well incentivized to help the students and XYZ thing. It's like it's a vicious cycle that I don't think anyone's really trying to change. Except for me. it's in my 10-year plan, but we're gonna get, that's a whole other story. But like,
Awesome.
I know, like education's no, but fingers crossed.
Yeah, good for you.
Let's see, Freddie, you've been quiet. What do you think of some of the stuff that we've been discussing over here this tonight? If Freddie is there. Freddie may not be there. Okay, moving on. Oh, Freddie, are you there? Okay, good. There's
Yeah, sorry about that. I don't know. I think that I mean we kind of touch on this every class, but the healthcare system has a lot of work and reforming to do. And like yeah, it's just there's a lot of work that really needs to be done in terms of not only just access, but just like I don't know, fixing a lot of the damage that's already been done.
Yeah. What are your opinions on science and its place in the current evolving community?
What do you just like science in general, or like?
How it's portrayed, I guess, nowadays.
Um, I mean, I feel like, certain communities like not fully, trusting, um, science can be, some concerns can be valid, you know what I mean? Like, granted, I trust science and, I've been vaccinated and stuff, but like, I know a lot of, Black people in the Black community specifically that had a lot of questions around the vaccine because of, the way that a lot of people are like, I don't know if I want to get vaccinated or not because, a lot of people just distrust the healthcare system as a whole. So like, again, kind of going back to what I said, previously, is there's just a lot of work and a lot of trust that needs to be built within the healthcare community as a whole in order to like, help everyone feel connected and be able to fully trust science.
It's a fair point. Yeah. And Freddie, is that also back to the point of, again, trusted education, that there's, it's easier for a lot of noise to kind of get amplified now, right? And tying it back to the point of social media and how easy it is for people to take a point of view and just expand on it and expose it. Do you also feel like that the root of it is a better education system allows people to have more analytical skills and kind of read things and watch things that say, yeah, this one I trust, this one I have to question, and so on? Is there a linkage there as well?
Yeah, I think that like, better education as well as like, transparency on, what specifically is happening is the most beneficial.
I think something that's sort of related that we've also touched on before is how like the US culture is so deeply rooted in individualism and privacy that even with all of the scientific and technological advancements we've made, it might be hard to actually like implement them just because of like privacy infringement. Like I think a couple of lectures ago, Francis mentioned a system that I think South Korea or like China was using in terms of like contact tracing for COVID that was actually like super successful in sort of maintaining a like shroud of protection against like anyone you've been in close contact with. Essentially, they'll notify you when you're in like within 6 feet of people who have had COVID. But we said how it would be like so difficult to actually implement that here in the US because there would be just so much push from just citizens here because they don't want their like location to be known by the government. Like they don't even want a vaccine because they think it's going to track them. So there's no way that people will want like their location to be known by the government.
I guess they forget that we all carry one of these devices around, right?
Yeah.
Yep.
Yeah, some of my pharmaceutical friends, just to have fun with the patients who come in and ask for the vaccine, and complain that the vaccine, they don't have the vaccine ready. They're like, "Why isn't the vaccine ready for me?" And they're like, "Oh, the microchips are still not sent in yet."
That's
Just to F with them.
awesome, but horrible. That is.
And of course, the patients just have this deer in the
Freak
head.
out. Yeah.
I'm just kidding.
Uh,
Yeah. But any other questions, anyone else? Again, very enlightening subjects and talks. Avanish, as usual, as always. Chloe, do you have anything that you want to, have you gathered your thoughts?
Yeah. I'm just kind of curious, like what your experience was in Brazil and then coming to the United States and like ways you can see like ways. Oh my, okay, I'm sorry, I'm trying to rephrase. And things that you can see working in Brazil that you've taken and adapted from the United States.
wow. Well, first of all, I think there's a lot of commonalities between Brazil and the US, right? So a lot of the cultural backgrounds, the mixes of people, right? So there's a mix of Europeans, African backgrounds. The largest Japanese community outside of Japan happens to be in Brazil because there was a concerted migration in the early 1900s with expertise in agriculture that came to Brazil. And there's now fourth, fifth generation Brazilians who are, of Japanese lineage, for example. So one thing that I always found amazing there, and I find it a little bit disconcerting here, is, and this may be a controversial point of view, but I'll share it, is there, everybody thinks of themselves as a Brazilian. There is no hyphenated Brazilian. And
There's no what? I'm sorry, can you say that one more time?
Hyphenated. There is no
Okay.
Chinese Brazilian, Italian Brazilian, Japanese Brazilian, right? It's everybody's a Brazilian. And part of it is there's been a lot more mixing and a lot more kind of the society is much more blended. And I have found that to be sometimes a bit of a challenge here. Is like we tend to silo ourselves in the US and kind of, there's communities that end up becoming a little bit too involved with themselves. Indian Americans, from my background, yeah, they a lot to hang out with each other, right? And only each other. It's like, we're here for, and whereas in Brazil, my circle of friends, people I spent time with when I was down there, it was all kinds of backgrounds. So I feel that's, again, could be a bit of a controversial topic, but I feel like for two countries that had if you track the genealogy, it's very similar. But there seems to be a lot more, mixing and without being ultra patriotic about it. People like, hey, it's Brazil. We're Brazilians. We're here. We grew up. I moved there until people heard my name. They couldn't tell that I was not from there, right? It's like, hey, dark-skinned Brazilian. No big deal. And I think it builds a tighter identity. So that's one thing, kind of at a social level. The other thing, and you guys are all some of you I think might already be in the workforce, soon to be in the workforce. One thing that the US I think has become unfortunately known for is this mindset that it's all about work, 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 work. And it's, there's a line that's used in Brazil that says, and friends of mine tell this to my face, and I don't have any counter argument, is you Americans live to work, and we work to live. And and all this, I work my tail off. My wife does too, and our kids seem to be similar. And Francis knows them. We have a hard time disconnecting, and there people have learned that, hey, there's times you just have to disconnect, and mental health issues and burnout and all these other kind of major health issues, I think, are not as prevalent in some of the other places. You go to Southern Europe, you go to Spain or Portugal, you go to Brazil, you go to Argentina, people take a month off, right? January is a month off. And, now we carry cell phones, so we're connected no matter where we go. Well, I have friends who say, no, in January when I'm off at the beach, I take I keep my texting app because my family and friends will text me, but my mail app, which is mostly for work stuff, I put that on a back page. It's not, and the line is, whatever crap was there when I left is going to be there when I come back. So it's a philosophy of life. I'm not sure, Chloe, you wanted me to get that philosophical, but it's the philosophy of, enjoy life a bit more and balance things out, hang out with family, travel, and take a month off here. Right? I have people on my team, they freak out by taking a week off. I have to push people to take vacation. I track that. I say, hey, but you haven't taken vacation in a while. What the heck? Take some time. Oh, but there's so much work, and what's going to happen if I leave? I'm like, hey, they'll survive. And it's a really interesting difference. Is that the kind of stuff you were looking for? I wasn't sure whether that was
No, yeah, definitely. Super interesting too, especially like the culture shock, in terms of like working in the United States and other places.
Yeah. And like I was there for 5 weeks, and I was trying to balance my work schedule here with stuff there, and people there, you usually go out to dinner at 9:30, kind of like, again, Portugal or Spain, and it's easy to be out till 1 or 2 in the morning and not get too panicked about the fact that there's work the next day. It's like, yeah, we'll be there. I may show up a little bit later.
It's just like generally like a lot of different like in terms of like difference in culture. Like I've noticed, just one quick comment I've noticed in the United States, like eating as a family is not necessarily something that's really important, and I know that that's like a huge thing. Like at least like when I grew up, like that was always like we have to eat dinner together, like every night. And coming to the United States, that was not something that was like normal. And it was just super, super weird because everybody's always working so long.
It's a great, a perfect example, right? And in fact, I'll take it one step further. So in Brazil, even now, it's very common for people who have the, the blessing of having grandparents still around, that grandma cooks for the whole clan on Sunday. And Sunday lunch, people mostly may still go to church or temple, but Sunday lunch is at grandma's house. If people are around and close by and so on, it's a guaranteed that grandma is cooking for 3, sometimes 4 generations. And it's not something you want to miss because it's fun and it's part of the culture, and when grandma's cooking usually is pretty awesome. So yeah, it's things like that, and it's basic stuff, but it does create a different kind of mindset. Francis, I actually have to head out to a dinner appointment at a Brazilian restaurant, in fact. Hopefully this was helpful. We've talked about 2 very, very different, healthcare is one huge topic, education and science is a whole different topic, but hopefully there's some nuggets of ideas for you folks to take forward as you kind of get into the world.
Thank you so much, Avanish. Always a pleasure. And I'm sure the students who haven't seen this that I recorded for, they're gonna love this as well too. Thank you, and hopefully we get to see you again soon. Okay.
My pleasure. Thank you all.
Thank you. Bye.
Take care. Good luck.
Thank you.
Bye.